Okay, we will go ahead and get started. As I mentioned before, this is Nidra Baldwin. I'm the Director of Community Engagement and Outreach. Ursula Robinson, our Executive Director, is unable to be on the call this evening. She had a death in her family and she is unable to participate in this call. But she definitely sends her hellos and that she looks forward to seeing those of you when we have an opportunity to see each other again. Joined on the town hall meeting with me is Lucilia Mero, our site manager, Dr. Julie Williams, Dr. Lakeisha Ensminger, and Adria Smith. What we'd like to do is first share some basic information. We've received a couple of questions already in addition to our frequently asked questions sheet that we send out. So I'd like to just share some information, and then we will open the lines for additional questions. If you've not already heard, we do intend to reopen the Adult Day section of our day program on Monday, July 6th. We are planning a responsible and safe reopening, and as a result, the following measures will be implemented for staff and participants to prevent the spread of the coronavirus. Our day center will open in 3 different levels. Participant attendance will be limited at each level. The first level, level 1, will begin July 6th. We will start with approximately 30 participants. We feel it necessary to start with a small number to allow for 6 feet distancing, the physical distancing within our center. Currently, we will continue the daily health screening questions. Participants will be contacted the day before they attend the day center. We will continue to practice the 3 W's, which are wearing a mask, washing hands, and waiting 6 feet apart. Staff will space themselves 6 feet from each other, as well as from participants when they are not providing care. Of course, when we are providing care, we will have masks on, as all staff members wear masks throughout the day, and we will have any necessary protective equipment that we need to provide the personal care. We will continue with the regular sanitizing of common surfaces, as well as areas throughout the center. We will conduct telehealth by phone using tablets or computer for follow-up and assessments. And our clinic is open for treatment and care. Home visits will be provided as needed for care and treatment as well. In terms of our vans, we will reduce the number of participants riding on vans to maintain the appropriate 6 feet distancing. Vans can generally accommodate 2 to 3 participants at a time. We will provide face coverings for participants to wear, and you're welcome to wear your own face covering if you do not have one. And as I said, staff will wear face coverings at all times. For those attending the day program, they will notice that the furniture in the day rooms have been arranged to maintain the 6 feet distancing between participants. Our initial staffing ratio would be 1 staff person to every 6 participants. Now, participants returning to the day center will be based on an objective screening tool that is designed to capture participant medical, social, psychological, and environmental needs. Many of you have already been contacted by a PACE social worker to discuss your desire to return to the PACE Center during level 1 or at a later time. For those that do return on Monday, there are some activities that we are no longer allowed to do at PACE due to the COVID pandemic. And as difficult as it is to say, We feel that it is very necessary to make these changes. Things that we will no longer be allowed to do in the day center include: we will not be able to sing. There will be no loud talking, no close range face-to-face interactions, no kissing, hugging, handshakes, fist bumps, or sharing of items or materials. We realize that, of course, having fun and having interaction in the day center is important, but we have to do the things that we do responsibly and safely. So what I'd like to do at this point is have Dr. Williams and Dr. Insminker to speak a little bit about some of the other questions that we've had posed to us regarding the medical piece of COVID.
Good evening, everybody. This is Dr. Williams. Welcome to our discussion this evening about where we are with PACE in the world of COVID. It's a new time, but we want to reassure you that the staff and leadership here at PACE at the Triad have been working very diligently to be able to continue to provide services and to get ready to welcome some of our folks back. Okay, one of the first things I wanted to discuss this evening was about testing. This is one of the most common questions we get because there's so much information out in our communities. We get a lot of questions about testing because we're reading about it in the news, we hear about it on the radio and on the TV. Testing is the way that our country and the world is going to get ahead of this virus spread. So I want to let you know why testing is being done, because there's a couple of different reasons. And if you understand those reasons, it's easier for you to understand when PACE will be testing and when we won't. So basically, the reasons that we test for COVID is because, number one, the most important is to evaluate somebody who's sick, and we have concern that they may have the illness. So we want to be able to identify that illness and get the person the treatment that they need. We also want to be able to inform any close contact family members or friends so that they can watch their own health carefully. So that is the first priority. Now, you will also notice that there have been a lot of screening pop-up sites that have been offered by various organizations, including the health department. And some of these have been located in communities, for example, in faith-based buildings, churches, in neighborhoods, in some apartment complexes. And the reason this testing is being done is to help our public health workers determine where the virus is in our communities and how it's being spread and how common it is. So in order for a person to participate in one of those pop-up sites, they don't have to feel sick. The reason the testing is being done is simply to figure out how many people may have it who may not even be aware that they have it. Another reason that we may be doing testing is before a medical procedure. Right now in the Moses Cone Hospital system and in surrounding health systems, before an individual undergoes an operation or a medical procedure, they are advised to have a COVID test done. And that test is actually done on the hospital campus, and it's organized by the specialist who will be doing the testing. There's no fee for that. And this ensures that the person going through the procedure or the surgery has no illness. And it also helps the people who are going to be in the procedure or operating room know what kind of personal protective equipment they're going to need. That helps them conserve that personal protective equipment, particularly for those people who are COVID positive in other situations, like the hospital or the emergency room. So here at Pace of the Triad, we will most definitely be able to do testing here on site. We've already performed a number of tests here at the Pace Clinic for people who have been concerned about potential illness. Or we'll be able to get you directed to testing sites that are specifically designed to evaluate people with symptoms. So we will be happy to make sure that any of our folks who have a concern about an illness because of symptoms, we're going to make sure they get tested. Now the next question follows, well, why don't you just test everybody? If you're getting ready to open up the building, why don't you test everyone? Well, the reason we don't is twofold. One is because we're going to be practicing the 3 W's religiously here at PACE among the staff, and we're going to be encouraging all of our participants to do the same when they're able. And when I say when they're able, I mean people who are willing to wear the mask and able to breathe comfortably and not be concerned about something covering their face, as may be the case in dementia. So we're already going to be practicing very safe transmission prevention precautions. The second reason that we're not going to be testing everyone is because we're going to be doing health screening questions and temperature checks before people even come here. That's going to happen twice. It's going to happen the night before via a phone call from one of the clinical staff, either the social worker or the healthcare coordinator, who will inquire about whether or not a person's had a fever or symptoms. And then the morning of pickup, the individual will again be asked about their symptoms, and they'll have their temperature checked by the PACE staff member before they even get on a van. So that way we're able to catch newly developing symptoms before the person even arrives here. Now I want you to reflect back again on where I was discussing how the public health personnel, like health departments, are doing pop-up screenings or screening certain populations, and they're doing that because they want to figure out where the virus is in the community and where it's spreading. They're only doing one-time tests in those situations. Now, if you think about it, every time you come in contact with another person out there in the community, you have the potential for acquiring the virus. So if we were to do testing on everybody, we pretty much have to say that we're going to do testing on an almost daily basis, which is really what we don't need to be doing. So to recap, PACE is going to be doing testing here or guiding testing at the hospital for anybody who has symptoms that could be of concern. We are going to continue with our transmission prevention measures, and you'll hear more about that as the phone call goes on, and we're happy to answer more questions as they arise. We're going to be doing our health screening questions, and we're going to be watching out for our participants and for each other. We're going to be very vigilant. We're going to do the best we can with the best information we have available from the CDC with all the personal protective equipment that will be required, both for the staff and for the participants. So that's a long answer about testing, but we've had so many different questions pertaining to that topic that we just wanted to kind of get that information out for you to think about. And then when we open it up to the question and answer portion of our call, then we can answer specific questions. So with that, I'm going to pass it back to Nidra.
Okay. Dr. Ensminger, is there anything that you'd like to add in terms of, I know one of the things I don't remember if you mentioned, Dr. Williams, was the temperature that the fever would need to be?
The temperature? The temperature guideline from the CDC is 100 degrees. That is a temperature measured in Fahrenheit on the thermometer. However, we also want everyone to know that if a person feels feverish or chilled, that alone is something that we would want to know about. So let's say if your temperature was 98 or 99, but you felt as though you were feverish or chilled, that's something that we would want to explore more. So that would be something that you'd certainly want to report. That was a good thing to point out.
Good evening. This is Dr. Ensminger. I just wanted to reiterate the importance of the 3 Ws, as Nidra and Dr. Williams stated: wearing a mask, washing your hands frequently, and also waiting 6 feet apart. There was a concern that came up about the 6 feet apart. There was a question, what if you're not able to wait 6 feet apart, and when would that occur? So, for example, in the event that perhaps someone is a fall risk and they need someone to make sure they don't fall, or maybe they're utilizing a wheelchair and need to be pushed to their designated space in the center, or perhaps the staff needs to assist a participant to the bathroom. Those are instances, with hands-on care where social distancing is not possible. However, we will continue to wear the appropriate protective wear so that we're keeping the infection. Also, to the screening questions, in addition to the temperatures being in screening the day prior, we ask that any participants who have symptoms or develop symptoms prior to coming to the PACE Center, even if you've just gotten off the phone with someone when you were asked a screening question, please make case aware so that we can follow up appropriately.
Okay, great. So what we will do at this point is open up our lines for additional questions.
Hello?
Yes.
Are you ready for me to ask a question, or was someone ahead of me?
Yes. Go ahead and ask your question.
Okay, I'm interested in what sort of tests I've seen on television, and my sister had a nasal swab, and which was, well, anyhow. And then I've seen them do it in the cheek. Which one is more effective, and which one will we have our participants be doing?
Excellent question. I can take that. This is Dr. Williams. The test that we will be doing is the nasal swab. The virus likes to divide and increase in numbers in the back of the nose, and there are 2 different swab types that can be used. One is a short swab that can be used in the front of the nostrils, and the other is a deeper swab that goes farther back in the nasal passage towards the throat area. Those are the ones that will be done. So the test is sent to the laboratory for processing, and the test results at this time are taking about 5 days to get an answer back. The more testing that's done in communities, the longer the wait time to get the results, simply because of the volume that the laboratories are processing. Good question.
Thank you.
I have a question.
Yes.
This is for my father. He's still with y'all. His name. He's a PACE participant. They have COVID-19 cases. They've had 7 cases now, 6 employees and 1 resident. Are they going to continue testing the people once they come out of quarantine again to make sure that they don't have COVID when they're allowed out of quarantine?
This is Dr. Ensminger. With the nursing facilities, they do have protocols in place where they are testing much more frequently to ensure that the infection is clearing and that participants are remaining as safe as possible.
Okay. his social worker, Ann, invited me to this meeting and said that this would be beneficial to ask some questions. That's one of my main questions I have, is if they're going to continue testing there at the facility. And also, my question was going to be, how many times are y'all going to be taking people's temperature that work for y'all there when y'all reopen the day center daily?
Yes, sir, daily. They will have their temperature checked before they even arrive to the building, and that will be done when they are picked up by the transportation staff. Every time they come to the building. So that goes for our participants and for the staff. The staff have to have their temperature checked every time they arrive for work each day also. So those are good questions. And just let me touch on the fact that in the news, you've probably read about how our nursing facilities have been hit particularly hard. It's been really difficult to read about that and to think about those individuals and their families, and particularly at a time when families can't visit. I think that's the hardest part for everyone. The facilities are under certain regulations and supervision for COVID, and they have protocols. They have clinical protocols that they follow. And yes, when there is an outbreak, which is 2 or more cases in a facility, they do have protocols for retesting. It depends upon where the participant was, what their symptoms are, a whole host of things, but they do have a system for repeat testing to answer that question.
Thank you.
Mm-hmm.
Thank you. What other questions?
Yeah, I was wondering what the status was on the dental and optometrist situation.
Let me make sure I understand the question correctly. You were asking about the gentleman optometrist situation?
Yeah, and the dental and the dental part.
Oh, I understand. The dental and gotcha. Okay. Dentist visits are available for emergencies, and eye visits depend on a number of things. We've got an eye specialist in town who has been able to see our people pretty shortly after a referral has been made, but they are trying to prioritize people with problems before they prioritize people who are just coming in for routine checks. Now, in the case of an individual who's living in a facility where there is COVID, part of the protocol for preventing transmission is that individuals in that building are not usually advised to leave that building unless it is for an emergency. So we ask that for folks who are living in one of our long-term care facilities, if a specialty visit, it could be eyes, it could be teeth, it could be heart, it could be anything. If a specialty visit is just for routine follow-up, those can usually wait, and that's probably the safest measure. If somebody needs to be seen urgently, then that's something that PACE would want to assist with, and we would help triage that. Does that answer the question? Sure.
Yes, ma'am. Thank you very much.
Okay. My question was, my participant has developmental disabilities and can't really take care of himself alone, and you may not be part of this, or maybe just know about his experience, so maybe I shouldn't ask it in this setting, but I'll let you know. I mean, you'll let me know. If he had to go into the hospital, and I understand people cannot go and visit them or help take care of him, what would we do about that? There's certain cognitive things he may not be able to understand that someone may want him to do that I would be able to understand, and things like that. I'm hoping won't happen, but and maybe we shouldn't even ask that question now. Maybe it's something I should talk to somebody privately about if anybody knows what would happen like that.
Well, the question is a really important question, and it pertains broadly to all sorts of people because, as you read about in the news, visitors are being restricted in our healthcare facilities, not just the nursing homes, but in the hospitals too. And for our PACE population, for your loved ones, this is a really scary thought to have to go into the ER and be hospitalized without your grounding comfort of your relative or your friend. So I think hospitals are starting to understand the importance of these caregivers being present more and more.
Okay.
And that they have tended to be a little more open to situations where we can advocate for a caregiver. Now, I won't promise that that's going to happen, but I've had a couple personal situations where the caregiver was allowed to come in because the individual truly needed their company. And problems with behavior or fear or anxiety were immediately alleviated once that caregiver was able to come. So they don't allow any more than one at a time and only on a case-by-case basis, and you'd probably have to have your PACE provider get involved to help advocate for that.
Yes. And it wasn't so much as the person being fearful, but not being able to communicate, whereas I have grown up with him and know pretty much what he wants or what he needs or he doesn't want, or can persuade him to take a pill or, right. That kind of thing. That was my concern. Yeah.
I want to say, this is a lame occupational therapist. I noticed recently that hospitals are stepping up for those occasions. And I think you can rest assured that they will take care of your needs. And especially if the person can't communicate or can't express their needs, they have been able to accommodate all situations, especially now.
Okay, well, that's good to know. They've got more experience now than a couple of months ago, so that's good. Thank you.
Thank you.
Does anyone on the call want to just have any concerns that they'd like to bring up? We're talking about reopening. I think there's a lot of anxiety that we're all dealing with COVID in the community. The news, listening to the news is enough to make anybody anxious anymore. But if there's anything you'd like to just talk through and say, I'm worried about my loved one going back because of such and such, we'd be glad to help talk you through those sorts of things.
I was just going to say, I'm concerned. Thank you. I'm just going to say I'm concerned for my dad where he's at right now because of the cases there. But I know they're quarantining everybody, and I'm just wondering if I did pull him out of there and I entered him back into the PACE program, y'all only got 3 days a week that y'all are open. And then I'd have to start all over with getting, home care here because I still have a job to go to, to survive. So it's been a big stress and trying to worry whether or not I'm doing the right thing. And I don't know if I am. If they keep having more and more people test positive over there, I feel like I need to get them out of there. And I don't know where if it's safe enough to bring him here, and then there's still a chance for him to get sick out here too, So anybody got some ideas on that? That'd be great.
I hear you, and I know the particular person you're speaking about, and if you'd like, I can talk to you at a different time just to weigh the pros and the cons of the different choices you're considering. I'd be happy to do that with you.
Thank you.
This is Dr. Williams. Sure.
I was going to go ahead and ask my question.
Yes.
Governor Cooper said the other day on TV that he was wondering about opening. He wanted to not open for the next 3 weeks about things. Did he change his mind, or do you know?
Are you referring to the phases?
Yes.
So per Governor Cooper, the plan is for phase 2 to end July the 17th.
Oh, okay. Okay. Thank you.
Does anyone else have questions?
Yes, ma'am, I got a question.
Okay.
After the 17th, will we have to come back to pace like we was doing, or will it remain the same?
I'm going to let Lucilia handle that question, our site manager.
All right.
So we have currently approved level 1 attendance. We have yet to make a determination regarding level 2 attendance. So right now, everything that we have in place for those who have been approved to return next Monday, July the 6th, that will remain until we make a transition to level 2 attendance. Does that answer?
Yeah, that answers the question. I got another question. I'm a high risk category, which I feel all right. I don't feel sick or nothing, but I chose to stay at home to August. Is that all right with PACE?
Yes, that is your decision to make, and that does not impact your enrollment or your attendance at the Adult Day Health Center whenever you make that decision to return.
Okay, thank you, ma'am.
You're very welcome.
When will we have another town hall? I find these very informative and helpful. Are you planning on having another?
I'm glad that you said that. It's very good to hear feedback from caregivers and participants about things like our newsletter and town hall meetings. And I think from the feedback that we've received thus far that this is definitely something that we intend to continue. We hope to be able to provide a date for the next town hall meeting in our newsletter. But I appreciate you mentioning that because it does seem to be a good way for us to get feedback from participants, as well as, you know, when you have opportunities to talk with, you know, your social worker. But we definitely will be getting some dates out pretty soon.
Okay, when you hear other people's questions and things, it makes you think of something you may not have thought of before. So I think it has many good qualities to have these meetings.
Yes, thank you.
You're welcome.
Yes.
I agree.
I mean, when you're on the beach, you gotta wear a mask.
Great.
Thank you.
Now, is there anyone on the call that is scheduled, whose loved one or is actually scheduled to come back on July 6th that has any questions?
Yes, I have a question. Yes,
Okay.
the ones that are already scheduled, have they been notified they will be coming back on the 6th? Because my uncle, they had called me and asked me if he wanted, you know, I think that he should be able to do for phase 1, and I think, yes, I told him I think he could do it. But he hasn't been notified.
Yes, everyone that has been approved for level 1 attendance, they have been contacted by their social worker.
Okay.
So if you have not received any further correspondence since the initial contact, please take some time to contact your social worker, and they will give you the feedback that you need at this time.
Okay, thank you.
You're welcome.
Okay, are there other questions?
Yes, I have another one about the testing of the nose. Can I have just the one, just barely up the nose? I don't want y'all to go way up because I used to have nosebleeds, and I don't want that. I mean, I don't want to deal with that. Can I just have the barely up the nose test?
This is Dr. Ensminger. I'm sure we can make that happen if you ever need the test.
Okay. Well, that's good. Thank you.
Yes, this is. I was just wondering, do y'all do you notify the different agencies that send out the CNAs, et cetera? Do y'all notify them of what PACE is doing?
Are you referring to testing as far as like positive test results, or?
I'm referring to like about the reopening. They will check in with me, you know, occasionally. I have two of them I go through, but they will check in, and they were just asking me about where that was PACE reopening, et cetera. I just didn't know if y'all gave them a generalized thing of what y'all were doing.
Are you referring to home care agencies when you said agencies, and just you mean general community partners?
Yeah, your partners like First Light Home Care or, you know, Rainbow 66, those agencies that put out the CNAs and for home care.
So
yes, we do.
Yes.
Okay. All right. I was just wondering.
Okay. So if you were impacted, for example, if a participant that you're caring for is returning and their home care services need to be adjusted, we would most definitely contact you to make you aware of that.
Okay. I was just wondering if they were, you know, kept up, you know, as to when y'all were reopening, et cetera, and what kind of phases y'all were doing. But that's all. That's all I wanted to know.
That is a great question, and I think sometimes what we want to communicate to our agency contacts that we are in touch with is to make sure that they share the information with their aides that are actually working in the homes, because sometimes information doesn't always trickle down. But I'm glad that you mentioned that.
Well, I thank you. I thank you for all y'all do.
Thank you.
And I just wanted to let you know, too, every now and then, my grandmother, she has dementia, but every now and then in her right mind, she talks about how she misses PACE.
That's wonderful. That's wonderful. Thank you so much. Are there any other questions?
I would just like to thank you guys for everything you're doing also.
Thank you. So what we will do is go ahead and wrap up the town hall for this time. We definitely will schedule another one, and we will keep you posted on when that date and time will be. We will keep you posted on the additional phases of opening up the center and making it available to more participants. Just as a personal note, we are still enrolling additional participants in our program because the need for care like we provide is still very much needed in our community. So if there are family or friends or coworkers that you've been in touch with who are in need of our support, please have them to contact us, and we'll be happy to see how we can help.
Is your age limit still, is it 55?
Yes.
Okay.
55 and up.
Okay. I have someone who needs it, but we're only in age 49, so it's not ready, but it'd be wonderful to help them. But I keep telling them about you.
Thank you so much.
You're welcome.
Yeah, I want to thank y'all for all your help, too. Sure do.
Thank you so much.
Okay, you're welcome.
Okay, well, thank you, members of our PACE team who are on the call. Thank you for your information that you've shared tonight. It's really been very informative. And thank you all for calling in, and we appreciate your attention and appreciate the opportunity to provide care for you or for your loved one.
Thank you.
Y'all very much.
Thank y'all very much.
Okay.
Thank you very much. Thank you.
Good night.
Yes, thank you.
Okay. Bye-bye.
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 Bye.
We're looking forward to